Hola, amigos de TV Agro. Mi nombre es Natalia Cediel.
Hello, friends of TV Agro. My name is Natalia Cediel, and I'm a professor at La Salle University in the area of veterinary public health, food safety, and health. Today, we are going to address the issue of health and its growing importance both in the rural world and in the urban world.
Importante para el mundo hoy en día, tanto en el mundo rural como en el mundo urbano. Una salud no es un concepto nuevo. Es lo primero que quiero que quede claro.
Although it is not a new concept, I want to make it clear that since ancient civilizations such as the Egyptians, Sumerians, and Hebrews, the intrinsic relationship between animal health and human health has been discussed and documented.
Esa relación intrínseca que hay entre la salud de los animales y la salud humana. Mucho más acá cuando...
An important milestone in the understanding of this relationship was the work of Hippocrates, who in his studies on water, air, and places began to document and speak clearly about the interrelationship between the environment, human health, and animal health.
Se vuelve más importante este concepto cuando empiezan a emerger enfermedades.
The concept of health becomes even more important when infectious diseases of a global nature begin to emerge with a global reach. At the end of the 20th century and the beginning of the 21st century, diseases such as Ebola, influenza,
Enfermedades como la influenza aviar, enfermedades que surgen de contextos en donde se ha invadido y se ha...
and others that emerge in contexts where the habitats of wild animals have been invaded and fragmented, generated a deeper call to governments, universities, and various actors of society to join efforts to sit down to discuss how to prevent these diseases.
juntos y empiecen a discutir cómo prevenir esas enfermedades. Fue en 2003, 2004 que se empieza a crear un marco.
In response to this need, a framework known as One World, One Health was established in 2003 and 2004.
Marcos regulatorios para poder prevenir enfermedades de estas y para que los países estén...
This regulatory framework was created with the objective of preventing these types of diseases and ensuring that countries are trained and prepared to not only prevent, but also respond to disease situations of this magnitude.
Se ha hecho mucha evidencia en artículos científicos sobre la importancia de este concepto.
For many years, scientific evidence was accumulated in the articles highlighting the importance of the One Health concept, but it was not given the due attention or taken seriously. It was really with the arrival of the COVID-19 pandemic that a very strong call was made worldwide for all countries to work together.
Biólogos, ecólogos, personas que trabajan en las ciencias sociales.
The need for veterinarians, human physicians, biologists, ecologists, and professionals from various disciplines to work together to address health challenges became apparent.
En el 2020 se hace un acuerdo.
In 2020, the French and German governments agreed to create a panel of high-level health experts.
Alto nivel en una salud. Dentro de todo este concepto hay 4 entidades que están liderando la...
In addition, the work of 4 international organizations that lead the implementation of this concept in each country is highlighted. The World Health Organization, the Food and Agriculture Organization of the United Nations, the World Organization of Animal Health, and the United Nations Environment Programme.
Esto se le llama la alianza cuadripartita. Dentro de este contexto político regional tenemos...
These organizations form the so-called quadripartite alliance. In the regional context of the Americas, the Pan American Health Organization has been a pioneer in promoting and applying the One Health approach.
6 líneas de acción estratégicas que son justamente destinadas a estudiar, a mapear, a generar la evidencia científica.
In September 2021, the Pan American Health Organization launched a One Health policy that is based on 6 strategic lines of action. These actions are aimed at studying, mapping, and generating scientific evidence to better inform health policies in the countries of the Americas.
Una salud en nuestro continente. En este marco, la Universidad de La Salle ha venido contribuyendo en generar...
In addition, it seeks to promote greater interrelation and articulation between all the actors involved in the One Health panorama in the continent. In this context, the Universidad de La Salle has contributed to the generation of a baseline that makes it possible to identify One Health initiatives in the region and highlight their importance worldwide. The Academy has played a fundamental role as a leader and promoter of this policy in the territories, demonstrating the importance of collaboration between the public and private sectors. In addition, work is underway to launch a global action plan consisting of 6 specific lines of action.
Ese fue un gran aporte que se hizo desde ese panel, pero también lo que viene a continuación. En estos últimos meses se está trabajando en crear una...
These focus on endemic diseases associated with poverty and lack of environmental sanitation, emerging diseases like we saw with coronavirus, and diseases caused by contact between humans and wildlife, antimicrobial resistance due to the misuse of drugs and antibiotics in both humans and animals, and the impact of climate change on health. The concept of One Health recognizes the interdependence between humans, animals, and the ecosystem, and highlights the need to address various aspects to achieve a cultural change in our relationship with nature. A fundamental principle is responsibility, which implies a change in behavior towards equity. Minority groups, often excluded from health policies, play a crucial role in protecting conservation sites and fostering a respectful relationship with animals and natural life.
Por el mal uso de los medicamentos o de los antibióticos, tanto en animales como en humanos. Y otra gran importante área de trabajo es el tema del cambio climático.
Therefore, the One Health concept calls for the inclusion of these groups and recognizes their valuable ancestral and traditional knowledge. Another important principle is the transdisciplinary approach, which transcends disciplines and emphasizes the importance of working with communities.
Hay que trabajar en varias cosas, en un cambio cultural, en un cambio que debe hacer la humanidad frente a esa relación con la naturaleza.
Instead of considering communities only as recipients of health policies and projects, they are valued as active creators of measures and policies. This implies close collaboration between communities, academics, the public sector, and the private sector, ensuring that no one is left behind in the implementation of health initiatives.
Sanitarias y son quienes muchas veces son los que protegen estos lugares de conservación de la naturaleza y los que saben muchas veces cómo entrar en una relación de respeto con los animales.
In addition, governments play a crucial role in allocating resources and committing to regulations to favour multisectorality. Lack of funding has been a major barrier to the implementation of the One Health approach, so pooled funding is necessary. Likewise, active surveillance of diseases in animals is required. Early reporting if there is a risk of transmission to humans, as well as environmental surveillance to address water, soil, and air contamination.
Sino como creadores de ellos. Es decir, en Una Salud se está valorizando el trabajo de codiseñar las medidas con comunidades, academia, sector público, sector privado. Es decir, no vamos a dejar a nadie atrás si queremos realmente hacer el trabajo de una salud.
In summary, the implementation of the One Health approach implies cultural and behavioural change, the inclusion of communities as policymakers, the recognition of ancestral and traditional knowledge, the allocation of resources by governments, and active vigilance of diseases and the environment.
Por eso se refiere mucho a que One Health es un abordaje transdisciplinario que va a involucrar no solo el conocimiento científico, sino también el conocimiento ancestral y el conocimiento tradicional de las personas. Y por último, se hace un llamado a esa acción que hacen los gobiernos en asignar esos recursos que necesita el hacer la implementación. Es decir, no solamente necesitamos que la gente sepa.
These challenges can be successfully addressed through joint funding and multi-sector collaboration.
Los gobiernos se hagan partícipes y se comprometan con regulaciones, crear regulaciones que favorezcan la multisectorialidad. ¿Por qué es importante para TV Agro y para la Universidad de La Salle socializar este concepto?
It is important for TV Agro and for the Universidad de La Salle to socialize the concept of One Health because the problems that this approach addresses, such as climate change, antimicrobial resistance, pandemics, contamination, and migrations, would be more and more frequent and complex. These problems cannot be solved solely from the perspective of a specific discipline or sector. The socialization of this concept makes it possible to promote dialogue mutual learning, and the active participation of different actors in the search for solutions. It is necessary that all voices are heard and that all sectors work together to design and implement effective measures. The dissemination of this approach seeks to raise awareness of shared problems and highlight the importance of collaboration and participation by all. It seeks to promote an integrated and transdisciplinary vision that considers both scientific and ancestral traditional knowledge. It seeks to promote an integrated and transdisciplinary vision that considers both scientific and ancestral and traditional knowledge. By promoting a broader and deeper understanding of the challenges we face in relation to human, animal, and environmental health, more effective and sustainable solutions can be found. Thus, it seeks to build a world with a healthier habitat, relationships of trust, and closer ties with life and natural resources. What we seek is to raise awareness, encourage dialogue and collaboration between different sectors, and promote integrated solutions to the challenges we face as a society in terms of health and sustainability. Thank you very much. This was a video for TV Agro from the University of La Salle.